I started to notice that I would get winded just doing basic housework, going from one end of the house to the other. By the time I got finished doing laundry, I would have to sit down and take a break. And I couldn't sing as well. I would get short of breath in the middle of a line and have to take a breath where I shouldn't have, and it just started to get worse and worse. I've been playing music 40 years now. It's been in 2020 I released an album trying to get out and support that now, but it's been very difficult. It's been very difficult because I could not do what I needed to do to go out and take 4 or 5 gigs a night in order to try and get my album off the ground, to get people knowing who I was. You have to have a public presence to promote an album, and I couldn't do it. I could play 1 or 2 gigs a week, and then I was exhausted.
We examined the x-rays, did a physical exam, and looked at her, and she had what we call an aneurysm of the ascending aorta. What an aneurysm is, it's a swelling of a blood vessel. And blood vessels are like balloons. The bigger they get, the thinner the walls get. You run the risk of the aneurysm breaking open or the walls separating, causing life-threatening conditions. So the aorta is shaped like a candy cane. The short part of the candy cane is the part that comes out of the heart. This is the part that Stephanie had an aneurysm of. And in order to fix that, you literally have to take that part of the aorta out and replace it with a special kind of surgical tubing that lasts for the entire life of the patient. And that then eliminates the risk of it breaking open or separating and really puts them back on a normal life without significant consequences.
I was the first heart surgery at the New Baptist Hospital, and they really treated me like a rock star. And I'm sure they do it for everyone, but I felt really special because everybody kept telling me, you know, you're our first patient, congratulations, you're gonna have an amazing visit. And it made me comfortable. It made me feel at ease and feel like everything was gonna go great.
So the setup of the new hospital is really nice. It has several amenities that most hospitals really don't cater to. For example, they have a private surgical waiting area with communication through a live person that can check on their loved ones with continuous up-to-date information via text or via email or via somebody sitting at a desk that can communicate where they're at in the procedure, when they're done, where they're going to recovery. There's a private surgical elevator. There's a outdoor waiting atrium, waiting garden area that both patients, when they're ready, and family members can sit and have some peace time and quiet time, really affording the best experience for both the patient and the families and friends.
At the New Baptist Hospital, they even offered to bring a roll-out bed into the room for my loved ones to spend the night if they wanted to. And I really loved that the nurse's station was right outside the room. I've never seen that before. I have noticed since my surgery that I am not getting winded at work. I'm able to do my job without feeling exhausted. By the time I walk up the stairs, I have been practicing my singing and it is coming along fantastically. I have even noticed that I can hit higher notes than I could before the surgery, that I can really belt it out. So that's great. Now I just have to get some control of it. My experience with Baptist and all of the caregivers at Baptist is that they really care about their patients.